Hello, everyone, and welcome everyone to this first webinar series for the World Kidney Day, organized by the partners of the consortium of the EU-funded project Kidney UK. Thank you very much for being here, for participating, and we're very excited with this first webinar, as is the first webinar of the series. We will have all the 4 webinars organized until the 23, 28 of March. You can find all the information regarding these next webinars on our webpage on kitnewcat.eu. This first webinar is going to be about sustainable kidney care from vision to practice. The webinar is going to try to answer to what extent the contextual conditions shape the opportunities and challenges involved in the decision-making for sustainable transformation of kidney care. So I give the floor to our partner, Diego Angelino. Diego, the floor
is
Cesar.
yours. Thank you very much. Thank you very much, and welcome everybody to this first webinar to mark the Working Day, that it was the past 12th of March, if I am correct. But we are starting with this series of webinars, so we are very happy to be the first ones in this series of events. So let me share my screen. And thank you very much. My name is Diego Angelino from the Nordic Center of Sustainable Healthcare. And with me is going to be presenting also Daniel Eriksson, the CEO of our organization. And for those who doesn't know who we are the Nordic Center for Sustainable Healthcare. We are a cross-sectorial network with a presence in around 25 countries. And we have in our network hospitals, clusters, universities, companies, big companies, small companies, medium companies, all the kind of actors who share the concern of transform the healthcare into a more sustainable sector. And why is that? It's because the healthcare have like a lot of impact on the environment. And maybe, as has been mentioned like several times here, healthcare accounts, depending on the country, from 5 to 8% of the CO2 emissions, plus the impact on water, plus the use of chemicals, plus the use of single-use items, and so on. But at the same time, there's like a big opportunity to work with sustainability within healthcare, because it's not only because the service, the provision of services that the sector provides to the well-being of the society, but also is the interconnection with the other complementary infrastructures in a community of a city, and even the foster of innovations in universities and the interconnection of different kind of areas of knowledge. So every area that work in the healthcare have a bigger impact. And just to think about like the scale of what nephrology of the kidney care represent in this like in this impact, in a recent visit that we have and we had like last week, we learned that in this particular nephrology center, the nephrology account for 6% of the total amount of waste generated by the hospital. So if you can see, there is like a quite like relevant impact of also about this area. So we, the Nordic Center, we aim to raise the awareness of this topic and we try to let know to the decision makers, but also to the practicants and the people involved in the sector that this is a very relevant subject. We boost the innovations and investment in sustainable healthcare, because it's not only to know that it's important, we need also to generate the innovations and to bring the money into the changes. We bring best practices and knowledge to the world, because we need to share the learning, and we try to deliver world-class solutions to the new markets. And in these activities, we recognize the complexity of the sector, the cross-sectorial implementation of the activities that we require to do. So all the work that we do is through collaboration, is through projects such as kidney care, but also with the particular collaborations that we have with companies or with other actors. Right now, for example, just talking about the area of projects, we are, besides the kidney care, we are part of another projects which are close one, and we are just starting one. So we are part of this consortium of Daphne for the decarbonizing of the healthcare in European Union regions. And we just start a new project with the Swedish Energy Agency about like with the objective to develop a tool for analyze the qualitative data for energy efficient healthcare. Part of that, we have our platform, the World's Greenest Hospital, or Grønn that is a showcase platform where you can find like some of the solutions implemented right now to make like an impact on sustainability related to the kidney care project. You can find there the Green Kidney Clinic. The Green Kidney Clinic is like a collaboration with the kidney care project that you can find like some of the solutions related to the kidney care. There you will find like some of the solutions that we already like identified along the project, and you will find who produced it, where do you can find it, and more information. So please go to the webpage and have a look on the World's Greenest Hospital. And well, everything like we have things happening all the time, as you can imagine, within the Nordic Center. So, for example, just today, this afternoon, and related to the project that we are like having today, we have a webinar on green design in single-use medical devices. So it's a methodology that we develop in another project where we try to bring in a 4 stages methodology, how to help the companies who make the question of how do I can start to redesign my product, to define in a better way the purpose of this idea, to collect the data that is relevant from a sustainable healthcare perspective, not only from a material perspective, to prototype with the presence of experts and so on, and to feedback from the users and potential clients. So this we will have it this afternoon. We have the crash course in sustainable healthcare for our members. It's for free in the next 27th of March. We have delegations of companies going to Canada, and also at the end of this month, the World's Greenest Hospital Live. And of course, in your calendar, you should already save the date of the 1st of October that we have the Nordic Conference of Sustainable Healthcare. So those who you know that we have the commitment to put a very relevant program in an entire week, full of activities, practicalities, and everything that can accelerate the implementation of sustainable healthcare, because of the reasons that we already mentioned. So for today, as Cesar already mentioned, we are presenting from vision to practice. So what we want to do what we will do in this session is that we will explore the challenges of how to develop a standardized practices and recommendations, where the settings are so different and the contextual factors influence both the barriers, but also the feasibility of implementing some of the sustainability practice. We will present to you some of the preliminary findings from 4 audits that we have already implemented in the 4 clinical sites of the kidney care project. And in general, we want to reflect on the contextual determinants for better adoption on sustainable strategies. So just a little back to the project. The kidney care, the effectiveness and accessibility of kidney care, and remains environmentally conscious and socially responsible, have these 3 main components: the data-driven insights, the innovative healthcare solutions, and the scalable sustainability practice. We, the Nordic Center for Sustainable Healthcare, has been involved especially in part of the innovative healthcare solutions. With 2 main activities, we implement what we call the Innovation Challenge, in 2 phases. Well, in fact, 3 phases, because we had a pre-innovation challenge, innovation challenge, and the second innovation challenge, and the develop of this catalog of a list of innovations. That it was a very wide list of innovations in different areas, especially the challenges that have been identified by the project, that is water, energy, and single-use items, among other high impact from the kidney care. But what we learned in the development of these tools is that nothing exists in isolation. I mean, the nephrology department is not just floating in the air. Like, the hospitals are part of and integrated within dynamic and diverse systems and subsystems. There are not two hospitals that are the same, even in the same country. So the context matters. That is our main learning along this process. Is not only the material relations of the infrastructure, but also like the subtle, the subjective power relations, the disparity between the possibility to influence what is need to be by what. For example, even the relations with the cleaning services in a hospital or the logistics within a hospital, every hospital has different particularities that need to be attended in order to accelerate the implementation of this. So after reviewing the catalog of solutions and innovations, like some of the clinical sites express that, yeah, thank you, no, are very useful to a certain extent, because many of these solutions are just suitable for a specific context and not to others. So what we propose to the project is to adapt a working model, a method that we develop and that previously we adapt to other projects to try to find out what are these contextual relations that can accelerate the implementation of sustainable solutions for the kidney care. So we have the NCSH model of method, and it's based on more than 20 years of experience, more than 200 audits, the work with different kind of management systems, the experience to work every day with the hospitals and the sustainability topics in different areas. And we already tested in some countries, no? We tested in India, in Poland, in Italy, and other European countries. And like a long story short, what the way that we implement this is through like 3 steps or 3 main stages. That is a questionnaire that is more like a guide for us, because it's an on-site visit, an audit, like a questionnaire what we like review all the kind of systems, subsystems, and make like all the observations and questions that are relevant for the sustainability. And with that, we define a baseline, a contextual baseline, so we can like start to work on sustainability with a gap analysis. And then we develop like an action plan based on short-term, medium-term, and long-term like recommendation, like things that you can like prioritize in order to have like the better impact. So what we do, well, this method covers like all the areas that you can imagine within a hospital that have like relevance for the sustainability. So management, training, the building, the energy, but also like those like small areas that usually are not like very looked into, like laundry or the labs or the food or the gases and so on. And for the case of kidney care, we include a selection of relevant questions that we extract from Edna, ERCA, and also from the recommended from other partners within the project. So thank you very much to our like partners in the Center for Sustainable Healthcare, and also Anita Griffin, our project lead, that helped us to compile like relevant questions for this particular area. And so what we try to do is to get in a clear understanding of the sites, to understand the differences, and to focus on implementation. So for that part that is more practical, I will invite to the room to Daniel Eriksson, our CEO of the Nordic Center, who will drive you to the adventure, to the experience that we have had in these 4 clinical sites. So thank you very much, and don't forget to go to our webpage and have a look on our events. Thank you. Daniel.
Thank you very much, Diego. And thank you very much, Cesar, for having the camera on so it doesn't feel like you're talking on nighttime radio. Sometimes when you don't see any people, then it's good to have. So I see someone reacting when we say something. My name is Daniel Eriksson, and I work with sustainability in healthcare for over 20 years. I started out as a sustainability coordinator at the university hospital for 5-6 years. And since then, been working with hospitals all over the world and regions and companies and medtech and clean tech and so on, all in the relation with sustainable healthcare. So we have seen a lot of things over the world that we're now trying to as I put into different projects that we are involved in here in Europe. The adaptation for kidney care in the when we're looking with the audit, we have the different types of ideas that we want. We want to get the understanding of the differences of the sites, get a clear understanding of how the sites works, and find out some kind of methodology that or not a methodology, we can call it a way of looking at the clinics from the context that they're in, and focus a little bit more on implementation and accessible innovations that already exist. We have learned for over the years that in many cases the need for innovation is less than you would assume in many projects. It's the knowledge of the existing innovations that is lacking very often. So in many cases, we see innovations or new practices or new solutions or even, tech that you can buy. In many cases, there's a gap with those who provide those solutions and those who procure them. And some are very, very, very regional. So if you do a classic 80-20, I would say that like 80% of the solutions you need already exist somewhere. You just need to find out. It can exist in your own hospital, in other nephrology clinics. It can exist in other departments of hospital, or exist in another setting, like in the industry and so on. And then when you have those things, you have a small portions of things that are not, you need to address, where there are no solutions today. And in many cases, also those, if you go to companies, meta companies, or to clean tech companies, they are developing these things. They are at least in the R&D department. So it's not that often that you need to invent something new, so to say. The four hospitals or the clinical sites that we have visited are UMC Utrecht, that are in the Netherlands. It's the Warsaw University Hospital in Warsaw, Poland. It's the Hospital Universitario Fundación in Madrid, Spain, and Unimore in Modena, the hospital there. And they're all a little bit different, both on geography. As you can see, they are quite evenly spread around the Europe, from east to south to west to north. And also that is one of the conclusions you can look at when you're looking at adaptations and solutions for Europe. Just the climate matter. How hot summer do you have? How cold winters do you have? That would matter for ventilation, heating, and cooling, and those kind of things. But also, if you're looking at a wider perspective on mitigation and adaptation to climate change and so on, of course, it's very, very different depending on where your nephrology clinic is situated, or your hospital are situated in Europe. And it's also quite a difference on access to clean energy, for example. Those who have a lot of countries with a lot of hydropower, for example, of course, you have access to cleaner energy than if your hospital is located where mainly it's coal-powered electricity. So the site where you are differs a lot, not only for which country you are, but the geography. What height are you on? Are you on a mountain hillside, or are you on a flatland, or are you next to a river, or you're not next to a river? So climate geography differs a lot and has quite a huge impact in those things. Also, of course, if we're looking at logistics and those kinds of things. Let's see, I will move this there. So some of the conclusions we have looked into is, for example, the energy mix, and it differs a lot between the different countries and the different sites. And why does this matter? In several reasons, of course. It means that interventions and innovations make more sense in some settings than others. To save, if you do, LCA mapping or carbon mapping and so on, it made sense to to save electricity might make a huge sense if you look at the climate at some sites, because you have high CO2 emissions per kilowatt hour of energy you purchase. But in other settings, that might not make that much sense because you are using, cleaner energy. So your efforts should be aimed at something else. Then all of a sudden maybe waste or looking at into chemicals and so on. So you need to balance those things where you have a high CO2 impact per kilowatt hour. It makes more sense to save energy in relation to other measures. So this is matters. So you have that will affect a little bit if you're looking at priorities for sustainability. To give a short example, if you would list the carbon intensity of different activities at the nephrology clinic, that would differ a lot depending on the energy mix in the area you are in. So if you would do this ranking on each side, it would probably differ quite a lot. Staff, of course, those 4 sites that we're visiting, they are in this project. So like as a baseline, they're interested in changing their sustainability impact in some way. So they are, positive. A lot of people have a sustainability experience and are very, very engaged. But as everyone else, a lot of people have quite a lot of workflow. It's hard to find time for sustainability. And in some cases also, we'll look at to a little bit later also how the organization is done. It depends a little bit. The hospital I worked at, for example, many years ago, University Hospital, we had 250 environmental coordinators that were staff working out in the hospital, at least 2 from each department. There were doctors and nurses and other staff that we trained to work with sustainability. So we had a total of 250 of those in a hospital with around 9,000 employees. And that was, of course, fantastic. But not all hospital has that kind of organization. We have the possibility to train people. We have a organization where you can send out the information and so on. And also the capacity of influence differs also. What can the nephrology clinic actually influence? What can they decide when it comes to sustainability? And also the setting in the city is also quite important, because the nephrology department is a part of a hospital and the hospital is a part of the city. So you're indirect or directly influenced, like on investment priorities of the city. Are they interested to extend the capacity for public transportation, for example, or district heating or district cooling and those kinds of things? There are decisions that are definitely beyond the decision of the nephrology clinic and almost also beyond the hospital. It's city that interacts with those things. So those who have these things like district heating and district cooling will automatically get quite a better climate impact and impact on other things, because of the city provides those things. Those who are in cities that provide centralized biogas digestion, of course, you take your food waste from the nephrology clinic and put it in the municipality waste digestion and get biogas. Of course, then the hospital and the nephrology clinic will do better on sustainability. But all those things are beyond the sphere of influence. So in many cases, you need those complementary infrastructure and the quality of the infrastructure, everything from grids to how you heat and cool and something. So there are several layers here, as you understand. It's the nephrology clinic that is a part of the hospital, and the hospital is part of a city in many cases that are part of national legislation that then are part of EU and the EU legislation. So it's important to think about how this influence the capacity of the clinics to do certain things or not. These are the 4 sites, if you're looking at them from a helicopter perspective. Access to public transportation is a little bit different. Some are very well, very well connected public transportations, and some are a little less. So it differs. How can staff and people get to and off the hospital and the nephrology clinic differs a bit. Some places parking and such are very scarce. Some have possibilities to charge your electric car and so on. Some don't. Some are easy to access by bicycle, some are not, and so on. So this is also the difference. Also, as we have seen, where the nephrology clinic is situated in the hospital also matters quite a lot. The influence they can make. If you're on the first floor, you have more options, for example, on centralized acid distribution and those kinds of things. But you're on the 7th floor and the elevator capacity is not that good, then all of a sudden you can move those big volumes of acid to another floor. That is not an option. So also where you are in the building matters in this sense. If we're looking at the governance as a topic, there is the responsibilities between the clinic and the building owner differs a lot. Even in some cases where the building is owned by the same entity as the nephrology clinic or the hospital, it might be another department in the city or in the region, or so all of a sudden, who is deciding that the nephrology clinic should have X, Y, or Z? Who decides that? That differs. Some cases, the clinic have a strong, can lobby for things, and sometimes get it through, but maybe not have the official governance of things, but have a strong lobby or have a good connection with the building. In other cases, you're just one of many tenants, so to say, and have to wait for those larger strategic reconstruction plans for a hospital, meaning that in the paper, 2028 you will get these things at this building, and then the nephrology doesn't have really the influence over those things. It's different if you take this in a larger scale. These are mainly those who are in the public sphere. Private sphere, you might have a little bit more options if you have those smaller clinics for dialysis, where there's private company that rent from private landlords. Of course, then you can make different contracts where you stipulate that you will have different things at a certain time. But this is also, so you can't say that all the clinics should do this, because it's not possible in all clinics. Some can, regional and local and national frameworks, or even legislations or soft law, or what we call it, could have quite a positive influence into the implementation of sustainability activities. It could be the city through the wastewater company stipulates that the hospital needs to do certain things, measure certain things, lower certain things. So those things can have quite a good, then you have an argument to work with it. And also, if you're looking at the governance roles for sustainability, it's a bit differentiated. In some cases, you have officials or environmental people from the municipalities that directly check things within the department. There's some, like water and such things, water quality and such things. And other parts, you're a part of a hospital that has a maintenance organization or sustainability organizations that handle those things. In some cases, you are under the governance of the municipality in the hospital. Some you have some sort of region, sometimes you're a private, sometimes you have a state healthcare. So that differs a lot, the governance of when you look at sustainability. Also, as we have seen, monitoring and reporting sustainability data are a bit different. What you're looking at and what you're not looking at, it depends on if the hospital, for example, has some kind of management system, ISO 14001, are connected to some different different, I don't know what we call it, but agreements with the international organizations on sustainability, or has signed, something with the local municipality, depending how. So you're measuring, reporting different things depending on governance, and if you have management systems, if you have some kind of certification for the buildings or not, and so on. So it's a little bit difference in data that are. And also we can say in many cases also there's a problem of lack of data, where the nephrology departments is just 2 half floors in a larger structure, so you don't actually have the data on the exact consumption on different things because you're part of the system. And those differences in organization form have a big impact on sustainability decisions, what decisions you can make or not. And that also goes through if you're looking at procurement. In some of the sites, departments and nephrology can be very active in the procurement process and ask for things. In other sites, you just get what is centrally procured, and you really don't have that much of a influence over that at all. So it's like a scale on that. But with that said, in the everyday, it's the nephrology that runs the nephrology and have the leadership role in the day by day, and there they have the big influence. The point of this is saying in some cases we might not expect the nephrology to do certain things because it's out of their sphere of influence. So we should focus on what exactly is in their sphere of influence, because otherwise some things are impossible. If you're looking at the energy still rely a lot on fossil fuels. It doesn't seem to be a lot of, if you're looking at, was a little bit surprised to me at the site. They're not much on green roofing, solar panels, and alternative renewable local sources of energy. There are some smaller things, but not in a larger scale, and not what we have. What you see in other countries, I would say there is a lot more focus on these things. So it could be national priorities, basically, that is, or how you fund those things, or different incentives, financially to install and not install that. There's a very big opportunity we see at the sites, and this is also larger in most cases than the clinic itself. There is a lot of opportunity. We're looking at sensors, illumination, ventilation control, presence, and so on. So in many cases it's a little bit on and off, and so on. So there we see that there is a lot of improvement, but also that is large investment. If we start to look at the ventilation system and so on for a whole building, it's large investments, of course. But in general, there is a lot of energy to be saved. Yeah, and if you look at the energy efficiency measures that we have seen, it's not superstructure ambitious, and most of them rely on regional local campaigns. And now we're not talking directly the clinics, because the clinics are a little bit part of it, but for the hospitals. So there is a bit improvement and working on energy efficiency in general, I would say, if we can find out. If you're looking at medtech and e-health for implementation, data collected is a little bit different in different details to different authorities for different purposes. So it's a lot of data that exists and so on, but it's hard to compare. So if you're looking at benchmarking and so on, that should be it's quite just to get the data quality, the data, how you compare pears and apples, as you say. With some cases you're measuring a little bit different, and you're looking at the dialysis machines and so on. There are many different machines, and we see that the generation of the machine has a huge impact on sustainability. And sometimes you can see 2 different machines next to each other when they are, prepared for the next patient. You can see quite visual to see the difference in amount of single-use packaging, or if you're using bags or canister or those kinds of things. The amount of plastic that is can differ quite a lot between the different machines, and you can visually see it with your eye when they prepare them next to each other. There are a lot of different backup systems in place, and of course there's legislation around that on 1 hour. Some also have some bigger UPS in the clinics built on old lead batteries. That is a second one, and then also diesel generators and so on are in place. There are some climate adaptation that we see, and it's also not really related to nephrology, but you know, the second realm, how the clinic is in a building that belongs to the hospital in itself. And I'm not an expert in climate adaptation, but some things we saw that you could change quite easily or should change regarding to rains and flooding and heating and so on. So when you're looking at climate adaptation, is also a thing that could be. I also had a discussion with those home patients, how that is handled, you know, with heat waves and so on. Patients are treated at home, and the risk around that is also something that could be brought up to attention here, because if you have some kind of heating, ventilation system or cooling system in the hospital for the patients at home, you don't have that, and how will that influence if you're looking, if you have this long heat waves in Southern Europe and so on. When you're looking at e-health and digitalizations, there's a difference in the level of maturity, I would say. Some are very advanced, some are doing double system. There are some digitalization, but they're keeping it on paper for safety reasons. You don't really trust the digital system. But there we think that there is a lot of cross-learning that can be done, because it's quite different in how you approach those things, and also the cost of it. I think in some countries where these things are more common or more a part of the daily practice, the price for those things also rapidly go down. So in some sites where price was an issue for implementing, and the price was, for me, way too much, where you see in other places, you know, in the cost per patients and so on for some of those digitalization stuff. There, I think it could be a little bit of both cross learnings, but also comparing the markets and the suppliers in the different regions. Seems like the cost differs quite a lot. If you're looking at waste and chemicals, yeah, everyone is doing things good, I would say. Everyone is quite structured and have following local regulations on, but there are a bit different systems in place, and how you're handling, for example, infectious waste and so on. There are different techniques in place, and that would also be interesting to see the different techniques, how they differ if you do some kind of LSA on it. Some are, you know, shredding it and using microwaves. Some are recycling bins that go to an incineration plant, and the bin is empty, sterilized, and goes back to the hospital. There are a little bit different ways how you're handling. In fact, that probably have some impact on the climate impact if you're looking at the whole value chain. So that is that I think could be a good learning to dig deep into that. In general, there are quite few chemicals, and most of them have quite a good management of chemicals. It could be some improvements regarding how, you know, how much safety data sheets you have and where you have them and so on. And that is also, you need to look into a little bit how the European REACH legislations are implemented in different countries. So it could be a difference there, but could be some improvement for those who don't like safety data sheet for chemicals. Sheets is a standardized protocol for each chemical that you are obliged to have, and to make it very simple, if a patient who is could be you know, dementia or suicidal, whatever, if they drink a chemical, should you give them milk or not give them milk? Should you make them vomit or not make them vomit? And those kinds of, and also a lot of information how you handle a spill and what safety measures you need to have for the staff and so on for the different chemicals. And that didn't seem to be all implemented in all sites. So that could be a thing to look into. Safe and have some knowledge sharing on that. Trainings there are, and many said that before kidney care, they had no training in sustainability. So kidney care has been like an opening door for these type of trainings. But there are different trainings, but not at a super priority, I would say. And everyone's when that is from the hospital side for training the staff in nephrology or in different ways. So kidney care has been a game changer for the clinics, I would say here, where they have received trainings and discussions. Yeah, and also roles in staff. It's a little bit beyond our scope and maybe more other partners in the project, but how you do things and the roles of the staff is a little bit different. Who is doing what when you're preparing the equipment for use, and how do you do it? Do you prepare for tomorrow or not, or what staff is? Some cases the staff are walking quite distances to pick up things. In other parts, you have external staff that put in the materials at the clinics and so on. So how you use the staff and time for it differs also quite a lot. We would say that if you have service staff that is servicing the clinicians or not, basically. And it's the same with pharmaceuticals, I would say. In some cases, you have external pharmacy at the hospital. They are stocking and keeping track. In others, you have a nurse that is the one keeping track, and so the same procedure could differ in how much time you spend within the clinic or someone outside the clinic are spending that time, I would say. But in general, very committed staff. There's a difference in sphere of influence. There's a difference in regional and national priorities. Differences on focus. But a little bit thing, we need to get the hospital management, the region on board. Integration with existing management system should be a priority, because in some cases you have different management systems, you have different building standards, you belong to different regional or city initiatives and so on, and sometimes those filter down to the nephrology clinic and sometimes they don't. And also different stakeholders, what are the different responsibilities in this, and it's a little bit of an exercise, but if you know exactly who is responsible for what, then you can focus on the things you have influence on. There's no use of chasing down facility management on ventilation if that's not in your sphere of influence, basically. So some preliminary findings. If you look at the clinics, it's a quite straightforward nephrology clinic from comparing to other parts of hospital. Quite little chemicals, no labs, maybe a little bit of labs in Moderna, but a lot of the bigger labs are outside the scope of the nephrology clinic. Products are very strange products. There's a lot of single-use items being in use. If you're looking at a wider scope where nephrology is, touching into, of course, OR, and then you have the whole thing with transplantation and OR and anesthesia and the labs and the diagnostics, facility management, procurement departments, and logistics. And this is some kind of, in some cases, you have bigger influence over that, and in some cases, you have lesser influence of that. And in the best of world, you would have a kidney care for each of these departments also, but have a project for anesthesia, so they jack into in the labs and diagnostics and so on. But as Diego expressed before, nephrology and all other parts of hospital are heavily integrated in all those other departments, and it's corresponding vessels in different ways. You press one button there, and it goes back. So it's quite complex. It's a complex look at one part of a hospital or of what. It's quite complex because sorting out what's the sphere of influence and not. So if you look at the main conclusions, nephrology sustainability needs to be integrated with the ecosystem. At the site, for example, overall prioritizations and goals. At the same time, nephrology can also be the front runner within the hospital to move sustainability forward. But in any case, those in the central administration or central sustainability needs to know what is happening on kidney care and interact with that in either case. It's very important to look at the different sites, what the actual sphere of influence is. So you don't have too high or wrong expectations of what the different sites actually can do due to, local restrictions or local governance or all these things we said. Influence on procurement is relative and some more or less, but in general it's quite limited. So there we have also an obstacle. It doesn't matter the findings we find within kidney care if you don't have an influence over the procurement. So there's a need for a wide range of innovations that works in different settings. And we can say that we can come a long way the next 10 years with existing solutions, just knowledge sharing between the hospital and nephrologists in Europe, and we can come very, very far by that. So of course we always need new innovations and so on, but it's not a blank paper. There exist a lot of solutions that can be implemented. If we're looking at the dialysis machines, we don't dig deeper today. There are some the card and the minutes looking at different filters and the technical details of the dialysis machines. But my conclusion is the newer the better from a sustainability point of view. That's it. If you have a newer machine, it's better for on sustainability. That's the general conclusion. You need to sort out what's big and small from a sustainability point of view, and that's also interact with what the hospital is doing. Because if you're doing a lot of LSAs and find out that, there's a little bit of plastic in something that we should change, and that costs a certain amount of money to do, that amount of money might do much more in another setting in the hospital. The same plastic maybe be used 200 times more in another clinic, so we need to sort out what it is the same thing, how nephrology and the interactions interact with the rest of hospitals. And of course, it would be good to have some kind of sustainable innovation labs with people who are working with this, because those are really working on the nephrology. Those are the ones that can come up with the best solution, so to say. So there should be some kind of innovation lab looking at some cross-sectorial here. I don't know exactly how, but something like that. But the main conclusion is that when you're looking at innovations for European kidney care, there is not one solution that fits all. One solution is the best if you're on the first floor, and another one is the best if you're on the third floor. One is best if your building is from 71, and another is best if your building is from 89. Of course, there are small bits and pieces that can fit in different in most areas, but in general, what kind of machines you have, what kind of energy mix you have, what kind of. So you need to have a wide range of innovations or solutions or technical solutions that can be adapted depending on the different sites, I would say. Yeah, time running up here, and we will release a little bit longer report on this with the different teams. And here you can see the themes we are looking at: gases, logistics, water, procurement, laboratory, and we will release that now when we have done all the different sites. So any month, any year, we will release that report. But that's it. And as we say in Sweden, tack for your listening, and we have a few minutes if there are any questions for Diego.
Thank you very much, Daniel, and thank you also, Diego. It's now clear, and thank you very much for this presentation. I also thank the audience. If you don't have any questions, you can still send us your questions visiting our webpage, kidneycare.eu. And we invite you to the next sessions that we have, also to the Nordic conference on sustainable healthcare. But also we invite you to visit the website, visit us also on LinkedIn, the Kidney Care, the EU as well. You can find it over there, and you can find also the dates for the next webinars. Great. It was great for me. I hope that it was also great for you guys. It was fantastic presentation. Thank you very much.
Yeah. Bye.
Ciao.
Bye bye.